In most countries, if someone climbs up onto the edge of a bridge and they're threatening to jump off, we do everything that we can to try and help them. And so we should. It's a recognition that that person is in a desperate position. It's a recognition that that person deserves our compassion and our help. And we called the fire service to set up crash mattresses to try and preserve their life if they fall. We called the police to try and help talk them down. But the difficulty is that when you introduce a euthanasia law, you change that entire paradigm round. Rather than that person knowing in that situation that they will be helped, they have to wonder, well, will I be helped? Will I be allowed to jump? Or perhaps more accurately, will I be pushed? These laws often come about in response to very, very difficult cases, people who are experiencing very, very extreme suffering, people who are in difficult and sometimes what they feel are desperate situations. And there's no denying that suffering. And these laws are presented as a response, as a compassionate response to those extreme cases. And they're put across as something that would happen in the exception, that euthanasia is something that would happen in very, very rare cases, that it would be the exception to the rule. The difficulty is that where these laws are introduced, euthanasia doesn't stay as the exception to the rule, but it increasingly becomes the norm. And that it actually changes the entire social contract. The number of people involved in euthanasia is probably a lot higher than most people would expect. The law requires that 3 doctors sign off on a euthanasia. It also requires that if there is a regular nursing team supporting the patient, that nursing team is consulted, although we know that that isn't always done in the way that the law envisages. And we also know that of those 3 doctors that are required to sign off, we know that it's actually a very small pool of doctors who are responsible for a relatively high proportion of the euthanasias that are carried out in Belgium every year. International law protects the right to life. It's a phrase that most people are familiar with. And the European Court of Human Rights has held repeatedly that the right to life cannot contain the exact opposite, a right to death. And that actually the right to life contains positive obligations for states to protect, in particular, vulnerable people living within their countries. So a state that knows that there is someone who is particularly vulnerable, so whether that be someone who is elderly, whether it be someone who's suffering from maybe a terminal illness or a psychiatric disorder, the state has an obligation in those cases to help those people, to protect them and to safeguard their right to life. Euthanasia was legalised in Belgium in 2002. And in 2014, Belgium became the first country in the world to extend that to allow the euthanasia of children. So there is now, in fact, no lower age limit in Belgium beyond which euthanasia is not possible. A child of any age, so long as they're assessed to have competence, can request euthanasia. And then we see, just 2 years after that, another attempt currently, to expand the realms of euthanasia in Belgium even further, to embrace patients suffering with psychiatric conditions, patients who are no longer competent, more attempts to expand the number of people and the types of people who can access euthanasia. And those who warned of the slippery slope have been proved right.